Today we have Gareth Dyke, and I am really happy that Gareth could make it today. Hi, Gareth.
Hi, how are you?
I'm very fine. It's also nice to say that Research Square have lots to offer and help researchers when it comes to medical writing. If you have checked the Research Square website, you could see that they have templates, digital editing, and this digital editing service is just amazing.
It is
Just to
amazing.
try it.
Yeah. Have you tried
Yes,
it? Did you try it? Did you try it?
yes,
Excellent.
yes. So it just, it was about 6 minutes came out and it was really amazing. So I really encourage every researcher to try this service. It is, you'll like it.
Yeah,
You'll
I've
like it.
used it too. You just upload a file and
Yes.
then less than 10 minutes later, you get the file back and it's edited. It's incredible.
For me, it took
Amazing.
6 minutes.
Ah, maybe that's because your English is very good, I'm sure.
Thank you. Thank you. So the mic with you now, Gareth. You could start now. Sarah, would you please unmute Gareth?
Oh, okay. Thank you very much. Sorry, I couldn't unmute myself there for a moment. So
Yeah, we had fixed this. We had fixed this.
yeah, Sarah, maybe it's possible to fix the settings a little bit so that if I have to mute myself to cough or something, I'll be able to
Yeah,
unmute myself
you could
again.
mute and unmute yourself now.
All right, well, everybody, thank you very much for joining us. Welcome back. This is the second in our series of joint events with our colleagues at Mars and CRK, with the wonderful Nuran Hamzi and colleagues. And thank you so much for joining us. Gareth is my name. Maybe you've attended one of our webinars in the past. Maybe this is your first time joining us. Well, welcome everybody to this event. Good evening, everybody. As usual, if you have questions, if you have comments, if you have feedback, we welcome them in the chat box. We will certainly have some time at the end of our session today to answer any of your questions. But of course, if something comes into your mind and you want to ask it as we go through our session this evening, then we do encourage you to put that question there into the chat box. So, managing medical writing. Gareth is my name, and Research Square Company is the name of the organization that I work for. I'm in charge of content now at Research Square, but before joining this company, I worked for a number of other companies and also as an academic for a number of years in Ireland, in the UK, and in the United States. So I've got some background in biology, and I've also got some background in medical writing, helping authors around the world to get their work successfully written up and published in those leading international journals. So you're probably asking, what are we going to be talking about this evening? Well, this evening we will talk about three things: starting to write as a medical writer, as a doctor, as a busy clinician, some tips, some insights, some ideas from our experience on that topic, some structures and templates for you for the different sections of an academic paper. And we're going to come back in later events in this series and talk in more detail about the different sections of academic writing. So if you enjoy this evening's event, we do encourage you to sign up for the ones that we have planned for our next for the future events. So starting to write, tricks for success, some structure and templates, and then some particular medical issues that you'll face as a medical writer, as a researcher, as a clinician, as a doctor, getting your work written up and published in those international journals. What's the point of all of this? Well, the point of all of this training, of course, is to help our colleagues around the world and help people to be more effective as academics. So that's our goal. That's what underlies all of this training to help people be more effective. So you'll be aware of all of these points, I'm sure. What's unique about medical writing? What's unique about writing papers in medical sciences and in the health sciences? Of course, this webinar is going to be recorded. Everyone will get a link to the recording. Everybody will also get a link to all of the slides that we use in this webinar this evening. So you can listen again, you can use my voice to put yourself to sleep, to put your children to sleep, to scare away the cats and dogs. I don't know. What's unique about medical writing? Well, of course, writers are extremely busy. I would argue often potentially more busy than researchers in other science fields or other academic fields. Potentially there are competing time demands. Of course there are. You may have clinical practice, you may have other responsibilities as a doctor, so these are important things to keep in mind for us as well. Your articles, the articles that you write, do need to be generally accessible and have a clear, immediate message. Very large, dynamic, and ever-changing literature. Again, compared to other STEM science subjects, the medical literature is faster moving, bigger, and ever-changing. And of course, then there's lots of information to synthesize and collate. So, unique things about medical writing. We're here, of course, to help you deal with these. So, why are medical articles, health science articles, different to other kinds of academic papers? Well, the sheer volume of information, the range of different audiences that have to digest that information, policymakers, patients, other researchers, for example, the speed at which the field is changing and the demands that are on you as a professional. So these are some of the things that we'll touch on this evening as we talk about managing the writing process as healthcare professionals, as doctors, and so on. So medical articles, medical writing, let's get started and think about initially, of course, the different kinds of medical articles that you might end up writing. And here they are listed: research papers, scientific reports, those standard peer-reviewed articles. But there are other kinds of articles that medical writers, medical researchers also have to do, have to create, have to put together that are different from the kinds of articles that we see in other STEM subjects. Case reports, clinical reports, drug discovery reports, trials and interventions. And there are, of course, as we talked about in our first webinar 2 weeks ago, very clear and distinct ethical issues around research and around publishing, but there's an extra layer in medical writing, in medical research. And we'll come back to that a little bit later on in our presentation this evening. But the field is big, the field is ever changing, the field is fast and dynamic. You've got lots of demands on your time, and there are more kinds of articles, pieces of writing that you might be expected to do. So all in all, it's a difficult thing that you're faced with. We're here to help, of course, at Mars, at Research Square. So why not get in touch with us if we can be of any assistance with writing in the future? And then added to all of that, recently, of course, we've had the extra layer on top of all of these issues that medical writers face, the COVID-19 pandemic. Now, papers that are relevant to this particular area of health science, social science related to the pandemic need to be written up and published as fast and efficiently as possible. And the publishing industry has changed. The academic publishing world has changed a lot. Let me tell you, over the last 2 years, huge differences. The onus now is very clearly on authors. Journals want articles, they want to publish them fast. So if you have something and you want to get it published, you're in the driving seat, is one of the messages that I have from our presentation this evening. This paradigm shift has changed a lot of things in academic publishing. So international journals, for example, are supporting this paradigm shift. We're encouraging authors to publish, and we're supporting the process a lot more than, I would argue, we used to do in the past, before the COVID-19 pandemic hit us all so hard and put us all in such a different place. So things like expedited peer review, no article processing charges in lots of journals. Many authors want their articles to be fully open access. There's a rapid green light for articles in preprint servers such as the Research Square preprint server, and I would encourage you to have a look at that if you're unaware of our preprint server. And basically, generally speaking, it's a much more open door for publishing articles these days than it was before. So that's something that you can do. You can be effective. You can make pre-submission inquiries to journals. We'll talk about that again in a minute. You can email your ideas, email your results, talk to editors about the information that you have that you're thinking about writing up and putting into your next article before you begin the writing process. You can send a bunch of emails. You can send 10 or 20 emails to different journal editors. You can make those pre-submission inquiries. We can help you with that, of course, if that's something that you'd like. And journal editors will get back to you. They will come back and they will say, well, Gareth, that's a good idea. We'd like to see that published. We'd like to see that submitted for peer review in our journal. So there are a number of things that you as a busy author can do to speed up the process of publishing your papers at the moment. And journals, of course, as we've already talked about, are in the business now of helping authors to get their work published as quickly as possible. So why not consider a preprint server, Research Square, bioRxiv, medRxiv, to name but a few. I can give you a full list of all of the preprint servers that are out there in the world at the moment if you're interested at the end of this presentation. These are open access online repositories for academic drafts of papers at any stage. Non-peer-reviewed work can be placed even before completion. You can get fast pre-submission feedback from experts in your field, make fast and accurate changes to your work, and this alerts journal editors to the location of your preprint as well as existing comments. You can speed up the peer review process. So as you begin to think about putting a paper together, putting your next article together for submission, why not make a pre-submission inquiry? Get a journal lined up before you begin the writing process. Why not put that work onto a preprint server so other colleagues in your field can get access to it, they can comment on it, they can look at it, they can get access to your results immediately. Preprint servers really are amazing, and of course we'll do further presentations in the future to talk about those in our series. So starting to write, my tricks for success: select the target journal before you begin the writing process. Aim as high as possible. Of course, we can help you with journal selection, choosing a journal effectively, and then managing your submissions to that target journal out of that preprint server environment. So don't just submit blind. Think about your target journal before you begin the writing process, because of course this gives you your structure. I always say that there are 3 things that you need to know before you begin the writing process. Your message. What's the take-home message of your article? What's the key thing that you want people to get out of reading your paper? What's the key result? The message. The audience, and that's the target journal. You're going to select that before you begin writing. You're going to make those pre-submission inquiries, and then structure. Message, audience, and structure. And here's the IMRAD academic article structure. Of course, everybody's very familiar with this or have seen this before. The general structure of an academic paper. I'm going to take you quickly through the different sections of your academic paper, give you some guidelines, a little bit of information about writing those different sections. If you'd like more, of course, we'll do future webinar presentations specifically on writing the different sections of papers. We have lots of information to provide you with after the event. Your article has a general structure. You identify that general structure by selecting a target journal before you begin the writing process. That's a great idea, because if you're then targeting the Lancet or the BMJ, I don't know, you know what's expected for putting information into those different sections. You've got your target journal in mind. And of course, your title and your abstract do perform a very different function to the rest of the paper. The title and the abstract filled with keywords optimized for SEO. These are the bits of the paper that people are going to use to find your work. And they're very often the only bits of your paper that other authors actually read. You can ask yourself the question, How many times have I actually read a paper all the way through to the end? Well, not all that often. Most people just read the title and the abstract. Then we go into the rest of the article, the IMRAD academic structure. So templates for writing the different sections. As a medical researcher, we know that the best kind of title, the kind of title that will garner the most citations in the medical literature, is a title that's short. And this has actually been shown to be the case with quantitative analyses of papers published in the medical literature. Less than 7 words is best if you want to get more citations. So you need a good title with the fewest possible words that adequately describe the contents of your paper. Keep the title short. Main issue, subject of the paper, accurate, unambiguous, specific, and complete. No strange, infrequently used abbreviations, and above all, attract people's attention, allure them, entice them, get them interested in wanting to read the rest of your study. An effective title takes work. It's worth putting the time into this. You need to make your titles compelling, concise, and informative. Most important words, entice the reader. Don't be over sensational. Don't give away the punchline. You don't want a title in the medical literature that tells the reader what the outcome is of the study. Medical journals discourage these kinds of completely descriptive titles where, you say something like drug A does this, because they want their readers, they want clinicians, they want doctors to actually read more than just the title. So for that reason, titles in the medical literature are often what we call non-declarative. So they say things like a study on the effects of X, Y, and Z, rather than X, Y, and Z are a cure for cancer, because people in the medical journal publishing system, they want people obviously to read more than just the title. So don't be over sensational. You may have to get some information on study design into the title, but short and simple is best, and less than 7 words if possible, to garner maximum citations with your article titles. This is a checklist. You can have a look at these slides a little bit later. You can have a look at the content in this presentation later. The other trick that's often used in English article writing in the title is the use of a colon in English. As you can see here in these examples, something specific followed by something general, short and snappy, and then an expansion. Alcohol use, a systematic study. Physical exercise and mental health, a cross-sectional study. People use the colon in English to break up the title, to keep the section short, to keep people interested. Something general, something specific, or something specific followed by something general. The key point here is that you need to think about your message. What is it that you want people to gain from reading your paper? What's the take-home message of your study? What's the one thing that you want people to gain from reading your work? Message, audience, and structure are the 3 things to have in mind before beginning the writing process, which brings us to the abstract, probably the most important part of an article. Of course, I always say that when you're writing an abstract, 250 words, it's important to imagine that this is the only piece of your article that people will read. Try to imagine that you're writing a conference abstract all the time when putting an abstract together. It needs to be honest and precise, stand alone, filled with keywords. It's got to be optimized for SEO. We can help you with that. Of course, titles, keywords, and abstracts are what search engines use to find your paper. So you want people to find your work so that they can cite it. That's very important. No technical jargon, short and specific, and usually no references. Of course, in high impact factor journals, the quality of the abstract informs the editor's decision as to whether or not to send the paper out for peer review. And you'll know yourself that in those big high impact factor academic journals, 9, 10, 80%, 90% of papers do not make it out for peer review. So it is worth putting the time into the title, the keywords, which we're not going to talk about in any detail this evening. We have other presentations on marketing approaches to get your papers written, get them ready for publication. Of course, most journals base their decisions on the abstract alone. And I find, sadly, many authors write their abstracts in a huge panic, almost as an afterthought. Concise, standalone piece of writing with a clear message, accurately reflecting the full text of the paper. We have lots of other presentations on this topic. If you're interested in checking them out after this webinar, just get in touch with me or in touch with Nuran. You can address, you can write an effective abstract by answering the 4 questions at the bottom of this slide. Why did you do the study? Answer that. What did you do? Answer that. What did you find? Answer that. And what did you conclude? If you do that, delete the questions, fill in the answers from information from your own study. You will end up with 200 words or so, maybe 150 that you can edit into your abstract. I guarantee it, this technique works for writing abstracts. That 4-question technique is fantastic. Why did you do the study? What did you do? What did you find? And what did you conclude? This is the basis, by the way, for all effective article writing. Overall, this 4-question basic technique for academic article structure. It's a structured abstract. Even if your journal doesn't want you to write a structured abstract, you should still do it in your mind's eye. And then, of course, delete the structure. And many medical journals, of course, want this anyway. They want those structured abstracts. You can put together a structured abstract, and then, of course, you can just delete the structure for submission, as we've talked about, using the 4-question technique. And I guarantee you that if you go to journals, articles published in journals, high-impact journals, editors are employed by those high-impact journals to ensure that authors do this. You can mark off with a colored pen, with a pencil, those answers to those 4 questions in an abstract. You'll find them, I guarantee it, in the sequence that we've discussed. Why do they come in that sequence? Because that's the basis for effective academic article writing, medical writing. Structure is the most crucial element. Very important. Message, audience, and structure are the 3 things to know before you begin the writing process. Your structure helps your readers to know where they are in the article, keeps them interested, keeps them engaged. It's like watching a movie, reading a detective story, my favorite kind of stories. Where have they come from? Where are they now? And where are they going? A plot is needed. A paper is like a story. So, how to get started with writing? We've talked about that. Let's talk really quickly about some of the other sections in your academic paper, because I know we're tight for time, but we have lots of other presentations. We'll be able to come back and do lots more webinars on the nitty-gritty, the nuts and bolts, the specifics of writing these different sections. In your introduction, it's important to grab the reader's attention. You've got about 1,500 words, the average length of an academic paper. It's about 4,500 to 5,000 words, not including the references. So you have to balance your writing. Try to grab the reader's attention. Keep this section short. I recommend 2 or 3 paragraphs will be sufficient, and we don't want to see a literature review in the introduction to a standard academic paper. Of course, if you're writing a review paper, a clinical review, or a full review article, then that would be different. But in a basic article, we have time only to talk about this evening, you are going to be structuring your introduction around an opening sentence that takes you straight to the issue, the most important details, a brief summary of the controversies, and then ending with a crisp, clear question and aim at the end of your introduction. And we, of course, also, as you'll see a bit later, recommend the use of active voice. I did this, we did this, our team did this, where possible, in your English academic writing. So 3 sections to the introduction. State the question. What's the reason for doing the study? Then you talk about the state of the art, what other work has been done recently around this topic that is relevant to this question, and then finish, as you'll see done in any Nature paper, any science paper, any high-profile international academic journal article. Here we show, tell the reader what the aims of the study are. And of course, to answer that quick question about abbreviations in the abstract, you can, of course, use abbreviations in both your abstract and in the main body text of your paper, but we treat those two sections of academic writing as separate, the abstract and the rest of the paper. So when you introduce abbreviations, you have to expand them when you use them for the first time. PCR, DNA would be exceptions to that because those are abbreviations that we use very commonly. When you use an abbreviation for the first time in the abstract, expand it and then give the abbreviation in brackets. Then you can use that abbreviation for the rest of the abstract. Then again, in the body text of the paper, the introduction and so on, you need to define your abbreviation again. Jumping back into the introduction, you need, or I recommend that you split this up into 3 sections: the question, the state of the art, and then ending with a snappy, simple sentence that talks about what you're going to be doing next. And of course, as I've mentioned, you'll all, of course, have access to a recording of this session. We will be able to provide a lot more information about all of these different sections, provide whole webinars, whole training sessions, whole day-long events if you're interested on the different bits of academic paper writing. We also provide consultancy and editing services if you're stuck yourself with a particular section of your next academic article. The introduction, what comes next, the methods. This is where you talk in a timeline sequence. This was done first, this was done second, this was done third, this was done fourth, about what you did in the study. Often, this is the bit of an academic paper that gets written first or second around the results. We'll talk about preprint services again, of course, at the end of this presentation, but your results and your methods are the bits of papers that you end up writing first. You put them into sequence, what was done first, second, third, and fourth in your methods. And of course, this is the bit where it's worth putting the time into the writing, because often editors, peer reviewers reject papers because they feel that there's an issue with the methods section. Something was done inappropriately. There's not enough information potentially. It's also important to check with a statistician. You may wish to get in touch with us to talk about that as well. If you're using statistics in your work, then that would of course be something that you need to check before you begin the work at all, before you even begin the study, to make sure that your statistics are watertight, that your statistics are going to give you the answer that you need to the question that you're asking. So method sections, top tip, keep them in sequence. Talk about what you did first, talk about what you did next, talk about what you did third, data collection, followed by data analysis. That's why, by the way, these sections of academic papers have such a tight structure. Field data collection, statistical analyses come last. Data collection, followed by data analysis. And I would also recommend that when you come to put your results section together, which again is one of the bits of academic paper writing that people often do first, they collect data, they end up with results, they make figures, they make tables, they put the results together, they make presentations to show their results. Here we have a section where you talk about the results of the study, but of course you don't yet attempt to interpret the meaning. This often, we also recommend that you hold the section subheadings the same in the results section as you had previously in the methods section. The trick here is knowing what information to include, what information to exclude. So often you don't present the raw data, you summarize that data with text, with tables and figures. And my top piece of advice for writing an effective results section is, of course, a picture is worth 1,000 words. We recommend that your individual results are summarized as figures, and then you talk about those figures. And that's the best way to structure your results section as well. Figure and then discussion of that figure. And you can refer to your figures in the text in the results section, maintaining the same sequence of events as you had in your methods section. So the facts, and nothing but the facts, ordered around the same primary and secondary outcomes as in the methods section. You state clearly and simply what you found, and we don't duplicate information in this section. Your figure captions should be stand alone. Again, can provide lots more information about this, but you will see often in the literature the same subheadings, the same sections in the results section as previously used in the methods. And then as we expand out that pyramid shape for academic writing at the end of the paper in the discussion, it's important to begin with a short sentence or two that tells the reader what the answer is to the question that you posed in the introduction. They've come all this way into the paper. They want to learn what the answer is. Here you give your interpretation, the discussion, interpretation. Those are synonyms in English, relating back to the objectives, relating back to the questions you raised in the introduction. Limit your data, of course. Limit your conclusions to what your data can actually support. One of the other big reasons for rejection, especially in clinical papers, medical research, healthcare papers, is doing too much with the data. And of course, you'll also want to suggest future directions for research, new methods, explanations why your data do and do not agree with what has already been published in the literature. That's also very important. We don't want to see an expansive essay that goes all over the place. Start your discussion with a single sentence that states your main findings. And we do also, very important, to talk about your limitations, any negative results, any things that your study could not discover, anything that you couldn't find out with your data. Strengths, weaknesses, limitations are very important. Why? Because presenting negative results in the academic literature helps other people to not make the same mistakes that you've made, to not go down those same blind alleys, those same dead-end streets that you've gone down. It adds to the literature. It provides lots of raw material for future clinical reviews, and it shows to the peer reviewers and editors that you are on top of the field. You are the expert in this field. So relate your study to what's already been found. Discuss what your study means and talk about any of those unanswered questions. And I do encourage everybody listening to this, please, 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 please do not finish your academic papers with sentences like, more research will be needed if we are going to address this issue, or further research will be required to fully answer this question. That's a weak way to finish an academic paper. Writing papers is like running a race. You need to finish with your strongest, most significant conclusion. People ask, how can I finish effectively my academic paper? Make a list of your outcomes. Make a list of your results, your outcomes, your main conclusions, put them in order, and then rank them and finish with the most important as the last sentence of the paper. This keeps the ending strong, leaves your readers with a good feeling about reading the paper. Medical research articles ask us for other things often as well, like research highlights. I've provided some summaries here as to what these are. Journals may ask you to summarize the highlights of your research. You may have to put these in as bullet points in the submission system. Again, it relates to your conclusions, your discussion, your 4 or 5 key outcomes from your research that will be effective, that will be interesting to a general readership. So it relates also back to the key take-homes of the study. So you might be aiming for 3 or 5 highlights, not including 85 characters, including spaces. And journals want these research highlights in order to attract readers, to increase their impact factor, because of course readership translates directly to journal impact factor. And of course, medical journals, big readership, broad readership, of course, lots of different stakeholders will engage with your paper. They are much more like magazines than articles in other areas of the academic literature. So let me give you a few tips for English writing. And of course, we'll come back again and do a lot more on this in later sessions in our series. Tips and tricks for effective English writing. No single style fits to everybody. A number of key skills, however, can be learned. And the plain golden rule, the effective golden rule for English language writing in academic papers is to keep it simple. Everybody agrees on this. Plain English is at the heart of effective written communication. Good commentators, trainers, people who work with the academic literature have identified 6 features of good, effective English. Short sentences, no unnecessary words, use familiar words, prefer the active to the passive voice, appropriate style, and good punctuation. It's important in English to be concise, to communicate your ideas clearly. Don't write things like this. In order to ascertain the efficaciousness of the program, all of the program participants who took part in the study were interrogated at some point upon program completion, where of course you could have written it much more clearly and much more simply. As you can see here, people often ask us, I need to use complex words that will make me look more intelligent, not in academic English. Please try to keep it simple. Why is that so important? Well, think about your readers. Most of the people reading your next clinical research paper, your next paper in healthcare, your next medical research article will not be native English speakers. Most of the research being done around the world, of course, is being done in countries where English is not spoken as the first language. So will using simple language in my writing make me appear less intelligent? Not at all, because the majority of academic papers are published in English, of course, and they're read by non-native speakers. So it is very important for you to be simple and direct in your writing. Most journals, especially, by the way, medical journals, want authors to write in the active voice. If you look at the guidelines for authors, you will see that that's the case. We recommend when writing your paper, use the active voice where possible. So at the end of your introduction, in your method section, in your results section, at the beginning of your discussion, we did this, we showed this, we have done this, we incorporated this, I collected, our team surveyed, we analyzed. Active voice for effective communication. It's important. It makes your sentences shorter and it makes them easier to understand. As you can see here, you can see what the difference is between the active voice down at the bottom in green and the third person, the passive voice up at the top. That's not to say, however, and people will have questions about this, I know, that's not to say, however, that there will not be places in your paper where you will need to write in the third person, in the passive voice. We'll come back to that in later webinars when we talk about English effective writing and English communication, but that's also something to keep in mind. You've got a lot of career paths ahead of you if you're a young researcher getting started as a medical writer, as a medical researcher, certainly developing the skills that we've talked about in our training this evening, writing structure, getting started to write, managing the process, building your articles can put you in a number of different places in the future in terms of your career. And of course, developing effective writing skills, especially if English is a second or third or fourth or fifth language, can really help you in the future. So my goal, our goal, Naran and I, the Mars organization, Research Square, our goal is to help you to get into the right mindset before you begin the writing process. Things to do before you start to write: your message, your audience, and your structure. I would like to please, if you remember one thing from this presentation this evening, it will be that trick to think before you begin to write. What do I need to have in mind? My message, my audience, and my article structure. Choose your topic, identify your audience, identify your purpose, gather your supporting information. We do have lots of experience working with authors around the world, editing their papers, helping them to be effective writing and publishing their content for international journals. So a roadmap for publishing, things to think about before you put pen to paper, how to sell yourself to an editor to get your work into high impact factor journals, developing a clear structure, and effective article writing. If you've enjoyed this presentation this evening and you'd like more, perhaps for your own organization or for your student, do please get in touch with Naran and we will provide that for you. We'll be glad to do one-off events for you at your organization to help, especially young researchers just getting going in the process with their article writing and publishing. The point of all of this is to help you to be more effective as a researcher. And I would just jump over this slide and just say one or two things before we go into the Q&A this evening about our company, about Research Square Company. We exist, of course, to make research communication fairer and more useful. We work with authors all over the world. You can see our website here. We've got a preprint server, and I've seen that lots of people have asked questions about this. Preprint servers are placed online where you can put your research before it peer reviewed by a journal for publication in order to share your results faster, to get feedback from the community of researchers working in your area faster, and to put yourself into the face, into the mind of those journal editors when it comes time for them to select your journal for potential peer review. So do have a look at the links on these slides. You can use our preprint server to get access to the latest research. You can also comment on emerging science. As Naran mentioned at the beginning of our event this evening, we have a second part of our company, which is the editing and author services part of our company, American Journal Experts. We have a very, very affordable, you can try it once for free, but it's very, very affordable digital editing tool that you can upload your papers into. It works really fantastically. I've been trying it over the last few days. Takes just a few minutes to get an edit done of your next paper. So do have a look at that link as well. This is my final slide. My name's Gareth Dyke. Here's a summary of some of the other services that we do provide. Have a look at our websites. Do get in touch with us if we can provide any other support based on the information that we've shared with you this evening. I'm also very happy down at the bottom of the screen to provide everybody listening to this or anybody else that you care to share this code with, Gareth 10% discount on any of our editing and professional services. So with that, I shall hand back to Naran, and thank you all very much for your attention and for the opportunity to do this presentation this evening. Thank you so much. Naran?
This was really amazing. You know, I got caught from the very first second till now. And by the way, I'm addicted to Grey's Anatomy, but in the way you have explained the slides, I may go to watching CSI or other investigation movies. Thank you so much, Gareth. I really appreciate this. You know, it is amazing, really. I guess the audience agree with me, right, dear audience? Yeah, we have lots of questions here, Gareth. If you have time, we could take few questions. Okay. There are questions here in the chat box. Are you hearing me quite well? Yeah, you are muted. Okay. 1 second. Okay, here we are.
All right, great. Sorry about that. I muted myself and I couldn't unmute myself.
Oh, there are
Thank you for the very kind words. It's great. We got some questions.
Yeah,
I think I talked about preprint servers again, but if anyone has any further questions about that, we could touch on that again, I think.
Yeah, someone is asking, Sarah has covered this question from who's watching us from the Facebook Live. Can we use abbreviations in the abstract section?
Yeah, absolutely. The only thing to keep in mind when using abbreviations in your academic writing is that you have to define those abbreviations the first time that you use them, unless the abbreviations that you're using are so commonly encountered that everybody understands their meaning already. So there are a few examples of those kinds of abbreviations that do not need to be expanded. DNA, PCR, GIS, for example, if you're doing more geographical research. But by and large, you know, RNA, DNA. These are commonly encountered abbreviations. They do not need to be expanded, but most of the time, the first time that you put an abbreviation into the abstract, expand it, and then you can use it again throughout the abstract. But then you've got to usually do that again in the body text. We treat the abstract and the body text of papers as separate pieces of writing. So yes, it's a great question. Thank you very much for that
Another
question.
question, yeah. How many studies from other location on the topic should we talk about on the introduction?
Yeah, that's another great question. The answer to that is not too many, because we're not looking for a literature review. We do not want you to put a literature review into the introduction, but you need to show enough previous work to be comprehensive, and also to show that your study is interesting and is something that deserves to be looked at. So I would look for review papers, first of all, that touch upon your area within your study area. So review papers are great to cite, but keep that citation number down if you can. And you can look at other articles published in your target journal in order to answer that question. What kind of level of information is needed for my introduction? Well, if you have a target journal in mind, then you can answer that question by looking at other papers recently published in that journal to guide you with your own writing.
Thank you, Gareth. There is a question from Sahar. She's asking if we used regular laboratory work such as CBC and the regular biochemistry tests in our study, should we add details about the kits and steps?
Again, that's a great question. Again, like it depends upon your target journal. So have a look at the journal that you've selected to submit to, and see what other authors do when writing papers similar to the kind of paper that you want to put together. Because often, if you're using a common method or an approach that's been applied a lot in your own field, and you're submitting your paper to a journal that's taking lots of articles in that particular subject area, then you may not need to explain again in detail, that particular method. Okay, so have a look at your target journal to see what's expected of you to answer that question. But a great question. Thank you.
Thank you. I get this question is somehow related. The coming question, can I write the steps were performed according to the manufacturer instructions, or I refer to a paper that made the same common steps of the experiment?
Yeah, that's another great question. Like if what you're doing in your methods section has been done before by other researchers, then you don't need to repeat that information. Very often it will be sufficient just to say the steps that were taken follow the method outlined in these citations, okay? So yeah, I would say unless you're doing something that's very novel and you're using a method that's not been applied in this particular way before, you can just talk about the manufacturer's instructions and cite some other articles which have used that method in the past. But that's another great question. Thank you. Yeah, I heard that question also a lot. So thank you for it.
Yeah, Isra is asking now, Gareth. She's about to write her first paper. Congratulations, Isra. This is really huge. Good. Yeah, good. I'm looking to publish my first paper. It is qualitative, and the topic is improving the health service quality. Can you recommend a journal for that topic? I will give you the mic for this because recommending a journal.
I will I won't answer that now, but I'll think about that and get back to you, Salah, if you can drop me an email or get in touch with Naran, because it's a very important question. Like the target journal that you pick for your paper is really, really important. So we would need to talk to you about what your paper is about, what your research is about, and spend some time to really investigate the answer to that question, to come up with a few good suggestions for journals that you might select for your article. So I prefer not to answer these kinds of questions like right now, but yeah, we can talk about that afterwards, and thank you. Because really the most important decision that you make as a researcher is which journal are you going to choose to target your paper. Yeah, it's a great question. I see there's another question about data in preprints. You can cite,
Yeah.
yes, you can cite what you see on preprint servers, because every article that appears on a preprint server gets assigned a DOI number, a digital object identifier number. So you can cite that information, but it will be clear to people reading your reference list and clicking on that DOI number that it's a Research Square preprint or a bioRxiv preprint. So they'll hopefully be able to quickly identify the fact that it's not yet peer reviewed. This is one of the issues with preprint servers, especially in our era of coronavirus. Lots of information, lots of work appears on preprint servers, gets reported in the media, because people outside of the primary research fields are often unaware that this work is not yet peer reviewed. So I'm thinking ivermectin is one good example of that. But yeah, like, be careful, but you certainly can use data in preprints as part of your references. That's a great question. Thank you very much for that.
I guess we had covered all the questions, right? Have we?
I hope so. I mean, if anyone wants to get in
Hi,
touch.
Karen is also here, Garis. May I introduce you to Karen, my partner in CRK?
Hi, nice to meet you.
Hi, Gareth, and thank you very much. We really appreciate the lot of information within a very short time, but we're really grateful from our team in Kenya. Really happy to work with you, and we thank you for your information. It's quite a lot. There's a lot to learn every day.
That's great. Thank you so much for the opportunity to do this, and I hope that one day we'll all get the chance to meet, like, in person, and you know, do something live. You never know, face to face. Who knows? Thank you very much.
Thank you.